breast cancer death rates are 40% higher in Black African American women compared to white American women. A lot of that disparity is indeed related to the social and economic inequities that we see here in the United States, with poverty rates and lack of insurance being higher in the African American community. And then there's also a whole host of other horrific manifestations of systemic racism in the healthcare system. However, there are definitely factors related to the genetics of African ancestry that also contribute. And the fact that African American women are twice as likely to have a biologically aggressive form of breast cancer known as triple negative breast cancer is one example of how genetics contribute to these disparities. And for the triple negative breast cancers, we cannot offer those hormonally active cancer fighting pills. So triple negative breast cancers are actually inherently more aggressive and more likely to metastasize.
That brought up my next question. You and your team member developed this new field of research named oncologic anthropology. Would you tell us more about this?
Yeah. As we continue to explore the connections between African ancestry and risk of triple negative breast cancer, our research team evolved to become this very large international group. And our team based here in the United States has research partners in different regions of Africa. Our oldest partners are located in Ghana at the Kamfanochi Teaching Hospital in Kumasi, Ghana. And then we also have research partners in Ethiopia, the St. Paul's Hospital with Millennium Medical College in Addis Ababa, Ethiopia. Now, interestingly, the frequency of triple negative breast cancers is very, very high among the Ghanaian breast cancer patients that we've been seeing. The frequency of triple negative breast cancers among the Ethiopian patients located in East Africa that we've been looking at is only about 15%, so it's also quite low. And then when you look at shared ancestry, it makes sense that we see these patterns because when you think back to the transatlantic slave trade from several hundred years ago, that slave trade brought the ancestors of contemporary Ghanaians on the western sub-Saharan coast of Africa across the ocean to serve as slaves in the colonies. And so as contemporary African Americans, we have a lot of shared ancestry with contemporary Ghanaians. The slave trade from East Africa, on the other hand, largely went further eastward to the Mideast and to Asia. So this is where the term oncologic anthropology comes into the picture. And currently, we have honed in on a particular genetic marker associated with Western Sub-Saharan African ancestry, and it's a marker called the Duffy null allele. It is a pattern that developed in the genetics of Western Sub-Saharan Africans several thousand years ago because it's one of the variants that developed as a consequence of populations in that part of Africa having to survive malaria. And the Duffy null variant confers some resistance to malaria. As a consequence, nearly all Western Sub-Saharan Africans carry that variant. In East Africa, the history of malaria is quite different because a lot of the mountainous areas of parts of East Africa and in Southern Africa don't support the mosquito life cycle, and the mosquito is the host for the malaria pathogen, of course. So you don't see the Duffy null variant expressed to the same degree in East Africa.
You just mentioned your work in Ghana and Ethiopia. I think it was 2004 you first took the initiative and reached out to the hospital in Ghana. Now, many years passed, you traveled back so many times. Could you share with us what have been done?
Sure, I'd love to. And I do want to emphasize that even though I've been stressing the fact that triple negative breast cancer is biologically more aggressive, When it's caught early, triple negative breast cancer does have an excellent survival rate. So it's extremely important for women to be mindful of breast health awareness, to get their mammograms regularly. If they notice a change in their breast, like a new lump or a bloody nipple discharge, change in the skin of the breast, please seek medical attention right away, because early detection makes a huge difference. And this is true even for triple negative breast cancer. For our international collaborations, over the past many years that we've been working in different parts of Africa, we have seen improvements made in terms of women presenting with breast cancers at more treatable stages. And our partners in Africa have been absolutely phenomenal in terms of being able to work very aggressively with their African patient populations, despite being handicapped by having so few resources to work with.